Welcome, everyone, and thank you for joining us. The Association for Professionals in Infection Control and Epidemiology is pleased to present this webinar in partnership with the Certification Board of Infection Control and Epidemiology. Before we get started, I would like to go over a few items for our participants. Please note that this presentation is being recorded and will be available within 24 hours. We encourage you to submit your questions at any time during the presentation using the Q&A tab at the bottom of your screen. If you need technical assistance, please send us a message in the chat box or send an email to elearning@apic.org. Today's session is titled, What is the CIC? And we'll provide an overview of the application process, test prep, and what to expect on the exam day, and then open it up for questions from the audience. And now I would like to introduce our moderators for today's session. APIC's Member Services Committee Chair, Randy Ennis, Infection Prevention Specialist with Northside Hospital, Cherokee, and APIC's Professional Development Committee Chair, Angel Mueller, Infection Prevention Director with Unity Point Health. Thank you to our committee chairs for hosting this informational session today. Randy will kick off our session today by welcoming our speakers, and Angel will manage our Q&A discussion later in the program. Randy, welcome, and I will turn it over to you.
Great, thank you very much. Thanks everyone, and welcome to our session today. It is my pleasure to introduce our speakers for today. Sandra Callery is the CIC President, and Jessica Dangles is our CIC Executive Director. Sandra has worked in the field of infection prevention and control for many years and is currently the Director of Infection Prevention and Control at the Ontario Agency of Health Protection and Promotion. Her other work experiences include clinical research and occupational health and safety. She has held several leadership positions in IPAC and has worked in a variety of healthcare settings, including public health, small community hospitals, and large tertiary care centers. Sandra is a registered nurse and holds a Master of Health Sciences in Healthcare Practice, where her research focused on HIV infection, counseling, and testing. Jessica Dangles began her career in certification at the National Council of State Boards of Nursing. Prior to working with CIC, she was the Accreditation Standards Manager at the American College of Surgeons within the Division of Research and Optimal Patient Care. Jessica holds a Bachelor of Arts in Women's and Gender Studies, a Master of Science in Human Resources, a Project Management Professional Certification, and her Master of Business Administration from the University of Illinois. She believes certification is an essential part of patient safety and public protection and enjoys working with the CIC board and staff to positively impact infection and infection control practices. Jessica, welcome to the program, and the audience is yours.
Thank you, Randy. We'll go ahead and get started. So thank you for joining our informational session on the CIC. Just a quick disclaimer here, but we will have this recording available to you within 24 hours. So I'm actually going to turn it over to Sandra, or our board president, for the beginning of this presentation.
Thank you, Jessica, and welcome everyone. We're really happy to be here with you today. And I think I want to begin by just reminding you, you heard that I've worked in this field for many years, and I just want to share with you a little story that happened, of course, during the COVID, when I was doing a little bit of closet cleaning and other things that people do during this time, and came across a box of old letters and that I had kept and saved. And in it was an envelope, just like the one on the slide here. And inside was a special thank you to me from the president and CEO of the hospital I worked in. And it was given to me shortly after I had received my first certification. I had made sure that my immediate supervisor was aware, and that was shared. And it was quite moving to see what he had to say, which was basically, thank you for doing this. Thank you for caring. Thank you for bringing this level of professionalism into our facility and for the safety of our patients and for our organization as a whole. And and congratulations. And it meant a lot to me. I just remember that all the feelings came back again about how happy and proud I was that I had actually received my certification and have maintained it ever since. But don't just take my word for it. On the next slide, you can see that we've actually tried to help share with all of you the value of the certification. And in 2019, we actually published in the American Journal of Infection Control around the value of certification through a large survey that we sent to employers, to those who were certified, for IPs who were yet to be certified. And what we found were some very interesting things. You can see here in the slide, one of them is that it supports higher salary compensation. There's more job satisfaction for those who have become certified, and it's considered valuable by the public and within the healthcare industry, especially for those that we surveyed. The next slide actually tells us a little bit more, that it instills that professionalism among practitioners. People felt a little bit more empowered, more confident when they were sharing information on our infection prevention and control. And it really was a way or a mechanism to recognize people who have spent time and learning in this field. And there's really no other way of being able to express it. The next slide actually talks about another article that was printed earlier this year in 2022, the impact of certification. And what they found by going through a lot of systematic review of the literature, they found that the IPs who are certified actually seem to have a stronger understanding around certain infection prevention and control practices. The IPs were more likely to recommend these practices in their hospital, but more importantly, the hospitals that hired certified IPs were more likely to implement those practices. So you can really see that there is an influence that happens with certification. So the purpose, though, if you get down to the bare bones, the purpose of the certification is to protect the public. And we do this through providing a standardized measurement of that essential knowledge needed for infection prevention and control professionals or practitioners. The certification board is actually a voluntary, autonomous, multidisciplinary board. So we're at arm's, although we work closely with APEC and other professional associations such as IPAC Canada, we are at arm's length of those organizations. And our key mission, our current mission, is to provide pathways to assess and maintain infection prevention competency. And our real vision here is to have healthcare without infection through some verifiable competency. So the certification, the CIC, you've seen that acronym quite a bit. It stands for Certification in Infection Prevention and Control. And it is actually the only standardized measurement of essential knowledge and skills for professionals in North America. But we're not limited to North America. Currently, we have over 8,700 CICs, and I think the numbers just has been climbing since we've even put this slide out. And we're in over 40 different countries. So CIC, or certification, is well described and expressed around the world. The last thing I want to say at this point in the slide, in the presentation, is really around the differences between certificate versus certification. And Jessica and I get these questions all the time. So a certificate is awarded following the completion of a course or a series of courses, and that provides you with some education. So you have successfully completed elements of a course. A certification, however, is awarded following successful completion of a comprehensive exam or an exam process. And it's a completely independent assessment of your knowledge and skills or competencies. So regardless of where you got your undergraduate degree, what college or university you attended, this certification is sort of that common ground where we are able to assess people's skills and knowledge and competencies in our field, independent of where they went to school for their undergraduate or graduate degrees. So that's why it's so important. Now, this part here is around the development cycle. I'll begin this and then Jessica will be taking over a little bit, but we really start by a fairly aggressive review of what we're doing in the field. And we do this every 2 to 3 years. We have a practice analysis that is sent out across North America and some other countries. And from that, we look at what are people in the field doing and what are the test specifications we need to include or incorporate. From that, we start to write the items or the questions for the exam. We assemble this together, we conduct beta tests, and those are set out so we can make sure the questions that we're asking are working appropriately. We set a passing score, and then we care and maintain that test until we do another practice analysis cycle. Now, I'm going to turn this over to Jessica to talk a little bit more about the NCCA.
Sure. Thank you, Sandra. The CIC is NCCA accredited, so we are the only examination in infection prevention and control to hold this accreditation. And what that means is we follow best practices when it comes to developing our examinations. So there is a rigorous set of standards that is required to develop our program, and we were just renewed for another 5 years. So I'll talk a little bit about the eligibility requirements, and then I can pass it back over to Sandra. So eligibility requirements include post-secondary education in a health-related field. So that can be nursing, laboratory technology, public health, and post-secondary can be associate's degree, bachelor's degree, RNs, LPNs, or LVNs. We get that question quite a bit, community colleges, and having direct responsibility for the infection prevention control activities in a healthcare setting. And in terms of work experience, that is defined as active engagement, actively employed in a position within infection prevention and control. And we do need at least 1 year of full-time employment, 2 years of part-time employment, or completed 3,000 hours of infection prevention work during the previous 3 years. And we do ask for documentation of this as part of your application. And Sandra, I'll let you go into a little more detail about these infection prevention activities because we do get some questions on this.
Oh, yes, thank you. So CIC eligibility, when we look at what are those activities, so to say that you have direct responsibility, you might not have all of the responsibility. You may be one person who's working in a department with a team of IPs. So, but it is part of your day-to-day responsibilities. So in that, you can see a variety of areas of infection prevention activities, from identification of infectious disease processes, surveillance and epidemiological investigations, preventing and controlling the transmission of an infectious agent. So how we confining and containing that environment of care, the space in and around the patient or the resident in the long-term care setting. So cleaning, disinfection, sterilization. So these are areas that you should know and understand what those terminologies mean and how they might be carried out. Employee and occupational health, again, close working relationships and collaboration with those areas of your healthcare related setting. Management and communication, and education and research, and teaching, education, orientation in infection prevention with your facility.
And I can talk a little bit about the exam application process. So once you've submitted your application and your examination fee, there are some key components that we need as part of your application. We need a job description that is signed by your manager or supervisor. And we do have a sample job description provided by APIC that's on our website. We need a copy of your resume. So we are looking to see that you have those years of experience as part of your application. And we need proof of post-secondary education. Those can be unofficial transcripts, official transcripts, a copy of your diploma. And then we need an attestation form that's completed and signed by your manager or your supervisor. And that outlines that you are indeed meeting all of the criteria as outlined in the previous slide. And from there, it usually takes about 3 to 5 business days for my team to review your application. And as soon as you're approved, you will receive an email from CBIC staff with information on how to schedule your exam. All candidates are given a 90-day period in which to schedule and sit for that examination. So I would encourage anyone that's considering applying, apply knowing that once you are approved, you will have a 90-day window in which to test. If you're not ready to test, I would encourage you to wait to apply until you are ready to receive that 90-day window. And if you do receive an email from our staff that you are deficient in anything, we will email you within 3 to 5 business days stating that your job description was not signed, we are unable to open any documents, but to really expedite the process, make sure you're following the criteria, and we do a good job outlining that on our website as well. Now, I want to talk about the candidate testing experience because I know some of you are already registered to take the exam. So the exam is offered via ProProctor or via Prometrics testing centers. Prometric is our partner in delivering the examinations, and you can take the exam either at a physical testing center, those are available worldwide, or you can take the exam at home. For those of you wishing to test at a Prometric testing center, they do have a very robust examination network in over 40 countries. You can test 5 to 7 days a week during normal business hours, and you will be monitored throughout the exam in a secure environment. There will be other test takers at the testing center during your examination, but you will have your own private little cubby as it looks on the screen here and noise canceling headphones, so you would not be disturbed by other candidates. And new within the last probably 2 years is the option to take your examination at home. So ProProctor is Prometric's live remote proctoring software. And this gives you the option to take the exam at home on your own computer. A live remote proctor is actually going to lock down your browser. They're going to do a 360-degree view of your room to make sure there's no study materials, no cell phones, and you can actually take the exam at home. I would not recommend taking the exam at work. You definitely want to make sure you don't have any distractions in the room, that your computer doesn't have any passwords or requirements that only your IT can get into, but I'll go into a little more detail about that in an upcoming slide. So before the exam, these are just some tips I put on here after speaking with a lot of candidates. Make sure you confirm your exam appointment on the Prometric website. Double check those time zones. So if you scheduled your exam while you're traveling, make sure the exam time zone that you scheduled your exam in is the one you're prepared to test in. If you're testing remotely, you will need to make sure that your computer meets those system requirements. You'll want to download ProProctor ahead of time and just do a run through to make sure everything's up and running. And if you're testing in a physical testing center, do confirm that address and the state before your appointment just to make sure that you're scheduling the exam where you want to be testing. And on exam day, we always recommend arriving 30 minutes early to the testing center or before that online appointment just to go through that check-in process. You'll want to bring your valid government-issued photo ID with you on the exam day, and that includes both the remote and in-person testing. So whether you're testing at a testing center or in the comfort of your own home, the proctor will need to see valid identification. And just a reminder, and we can't stress this enough, study materials and cell phones are not accessible during your exam. So those will not be allowed within the testing room. If you're testing at a testing site, you can leave those in a locker. And if you're testing at home, don't have them in the room. The proctor will do a full screen of your room, and no cell phones, no study materials are accessible during the exam. And the CIC, it's multiple choice questions, 150 of those, and 135 are scored items. So every examination has 15 what we call pre-test items. And those are examination items that are not actually scored on your exam, but ones we're trying to get data on. And those won't be listed as pre-test items. So answer every question with the assumption that everything is going to be scored. You'll have 3 hours to complete your examination, and the results are available immediately after testing. Prometric will email you a score report after about an hour or so after finishing the exam. They'll email you a score report. And candidates that pass the exam will receive a pass, and candidates that are unsuccessful will receive a breakdown of what areas on the exam need further studying. And before I end things on the CIC, once you are certified, your certification is valid for 5 years. And on a future webinar, once you're certified, we'll go into more detail on this, but recertification can be completed through infection prevention units, which we call IPUs, or via an at-home open book examination. And we'll certainly take time to talk more about the CIC, but I wanted to talk a little bit more about other exam offerings. So I'll turn it over to Sandra here.
Yes, in the last few years, we've had a couple of new other exam offerings. This one is the Associate IPC. infection prevention and control examination. We see this as an entry-level certification. We've heard from many people in the past how they would like to get in the field, but they can't be hired, or people don't see them as someone to hire because they can't demonstrate their knowledge through CIC because they don't have enough hours. So they got in that vicious cycle of not ever being able to demonstrate they have some knowledge and would like to pursue the career. So the AIPC fit the bill for us. It's an entry-level certification exam. It's really to measure basic infection prevention competency. It was developed and intended for that novice IP, as I mentioned, who's interested in pursuing a career in infection prevention control, but may not have all of the eligibility for CIC at this time. So on the next slide, you can see that, just to emphasize, there's no job specific or educational requirements to apply for this. It's really intended for those with some formal education, but without current work-related duties. And we see this as a perfect stepping stone to prove a candidate's foundational knowledge, their dedication to the field, and just to get them into the door, into the field. So the other certification that we want to mention is the long-term care certification. This is very new. Certainly in 2021, we have to thank many individuals you can see who participated in that long-term care job practice analysis survey. And they did this in the middle of the pandemic, so we're very grateful for that. The survey provided insight into those tasks and the knowledge important for IPs in a long-term care setting. We've heard that as well from them in the past, that the content we may be testing them on several knowledge domains the same, but they didn't often see their setting reflected in the exam they were writing. So this survey results really guided the creation of the test content outline, and all the test questions are based on this job task analysis survey. You need to know, though, that we did develop this with the same rigor as we do with the CIC. So the next slide tells you a little bit about those eligibility requirements. The person needs to be responsible for the infection prevention control programs and activities in their long-term care setting. We want an attestation on behalf of the candidate. And we want them, they should have completed post-secondary education, healthcare related field, similar to what we are expecting for those with CIC. So those are the key elements of the eligibility. The next slide is really about our exam and availability. And I'm going to turn it over to Jessica so she has the details, finer details for this.
Sure. So we just beta tested the long-term care examination. Those results were just released last week. And beta testing, what we mean by that is we don't have any statistics available on those items yet. So we had to see how those questions were performing before we could release the results to our first candidate pool. So those results are out, and starting February 1st, the application will be open for daily testing. And now I'm going to turn it over to our moderator to go through some questions. I'm sure there's a lot of great questions, so I will unshare my screen and take some time to hear from all of you.
Thank you both so very much for that fantastic information that you've covered. So it's now time for our Q&A portion. As a reminder, please submit your question into the Q&A box and hit submit. So we'll start with some questions that were submitted ahead of time. And I think some of this was covered, but it'd probably be good to go back to these questions and cover these topics in more detail. So the first question, if someone has previously held the CIC certification, but had a lapse in their certification, their primary role was not infection prevention during that time where they had that lapse, do they still need to wait the specific time frame, that 1 or 2 years, to sit for the test again?
I would say no. So as long as you have that 1 year full-time or 2 years of part-time experience under your belt from previous years and you're actively working, that's all we'd be looking at. So that's why we want to see a copy of your CV and your job description.
And particularly if it's only 1 or 2 years with a gap in between, I think that the person would be still probably quite successful. Remembering, I always like to remind people that CIC is not just an exam. It's also about your years of experience and your foundation. So when an employer looks at this person's name and they see CIC, they see a package. They see someone who has experience in the field, plus they've passed this exam, and they have foundational knowledge through their educational portfolio to demonstrate that they can handle the role. So it's a package that comes when we give people the CIC.
All right, great, thank you. The second question we had is, and I know you covered this as well, but it might be good to go back through it, is what is the process for getting certified in other countries? For example, Nigeria, that country was specifically called out. Are there exam centers available in Nigeria? Perhaps where can someone find a list of all the optional options for exam centers? And then I know you did cover the pro-proctor opportunity for using your own personal computer if there is not an exam center as well. So maybe go through some of that again.
Sure. I'm going to drop in the chat. The Prometric website allows you to put in your postal code and find a testing center near you. They may not have a testing center in Nigeria. There are some countries where they don't have testing sites, but that's the great option with ProProctor. So you can take the examination anywhere in the world and take that exam at home. So there shouldn't be any roadblocks in terms of being able to take the examination, but you would need internet access and a computer in order to take that examination.
Great, so many opportunities. The third question we have is, does the long-term care certification hold the same weight as the general CIC? So I think this is a great question. They ask, is the recommendation to obtain both the general CIC as well as the LTC certification, or would the LTC certification cover the same items in addition to the LTC component? So this person doesn't want to limit themselves to the LTC.
Well, I'll begin. I think we started by saying the same rigor is applied when for both the test development. That's one thing. So you can be assured that you're being tested at the same at that same level. The knowledge domains, or the areas that we cover, are very, very similar as well. And those are listed on our website. You can actually see all the different areas that we cover in both the CIC and the long-term care. And they're quite comparable. Where we have shifted or changed things for the long-term care certification is really around terminology. So we use the words resident rather than patient. If you are looking at an infectious disease, the setting they may describe will be the long-term care home and not the neonatal ICU. So there are things there that make it a little more familiar. I think when it comes to which certification is best, I think you also might want to put think about your own self and your own future and where you may want to work, and which setting might be more attractive to the employer as well. So if I have a long-term care settings that I am passionate about and planning to work there, that might work better for you, but you will have been tested, if you will, on almost exactly the same knowledge domains as you will be in our CIC. If I'm working in acute care, they may wish to see that CIC, which is our sort of a standalone certification that we've had for years and has been tested, tried and true. So it really is up to the person and how they want to see them, but there's no requirement to have both certifications. And as I said, the knowledge domains are quite close, but don't just take my word for it. Look on our website. You'll see all of the knowledge domains that are tested listed there.
Great information to cover. I'm sure a lot of people have that similar question. So another great question is, how can someone prepare themselves for the exam? Any recommendations for study materials, online questions that they should review? Any recommendations that either or both of you may have?
Well, I would say study groups are definitely a great option. I know a lot of the APIC chapters have study groups, and it's great if you can find some people to connect with within your local APIC chapter. I will kind of say our kind of our standard line for how to prepare for the exam is we are the ones that develop the exam, so we can't recommend or endorse any specific study guide, prep course, anything like that. I know APIC has an entire department just for preparing candidates for the CIC, so you can definitely take a look at that, but I would definitely engage with your local IPAC Canada chapter, your APIC chapter, and find some colleagues to prep with. Sandra, any thoughts on preparing the exam as someone that's certified?
Well, I think in addition to what Jessica said, and I do think that chapters in professional associations and their chapters have been really remarkable in terms of helping you prepare and nurturing people along for the exam. So I totally agree with that. I think the second thing is to note that we do give the resources and the references that we use for the exam development. And so making sure you're familiar with those, because then that's actually where we will be gathering evidence to support any of the questions and answers that we create. So looking on our site, our website, you will see the resources that are used, the references that are used for that development, and that may also be of help to you.
Great. Thank you for that information. So we do have some additional questions now in our Q&A section. So I'll go through those and try to consolidate where I can. Another great question about international certification. This individual does state there are several countries who still do not acknowledge or accredit certification under their health commissions. So is there a way that CIVIC could possibly help support IPs working in those locations? Any coordination, collaboration with those locations, or even just promotion of awareness about certification, it sounds like would be much appreciated.
Well, I'll begin by saying, and Angel, you probably can chime in as well in your role, because we do know that we, the APIC and other professional associations are working closely with IFIC on our International Federation for Infection Control, looking at where we can bring together certification and a standardized approach to certification around the world, around the globe. But as we mentioned, we have over, people are certified in 40 different countries around the world. So reaching out and even looking online, Jessica and her team have been really great in profiling different certificates around the world. And that's how we influence, that's how you change things. So I would strongly recommend that if you feel confident and ready to be certified, go for it and then share with others. And we've actually heard from other candidates outside of North America who've done just that and have really promoted it. And but Jessica, as I said, has great testimonials from people who have taken this on. So I'll turn it to her if she has anything to add.
I don't think anything further, but just know that our partner organizations work very closely with CIBIC, so IFIC, IPAC Canada, and APIC, and we've definitely heard you, and we are working to spread as much awareness as we can about certification. And for those of you that are certified, please let us feature you on our website. I think it's great to have testimonials and why certification is so important to you.
Great, perfect. Thank you both. Another specific question about the job description. So does the signed job description have to be within a certain time frame to the application? So let's say somebody gets the job description signed today, but they end up not applying for 6 to 12 months down the road.
We like to see it at least during that calendar year. So we look at your job description, we look at your resume and want to make sure that those match up. So, I always say, apply for the exam, assuming you're going to take that exam within the next 90 days. So an outdated job description or an outdated CV, our staff will come back and ask you to get a more current attestation, current job description that's signed. So something from a year ago, we'd come back and ask to see a more recent signature from your supervisor.
Great recommendations. Thank you. Some additional questions around the CIC compared to the LTC CIC. So if someone works in critical access, which has acute care plus long-term care, what would be the recommendations, the CIC or the long-term care certification?
I'll start. If I were in your shoes, I think I would and I felt confident to write either. I think I would go for the CIC because it would cover both areas that you're concerned about. Again, just because of it, there may be nuances to the role, and this would demonstrate that you have that broader knowledge that could be applied. But again, it just really depends on the person and where you feel confident in your knowledge and expertise.
Yes, great answer. It sounds like you could not go wrong with either one. And again, along those lines, this is a great question. Are there any plans for certification related to ambulatory or primary care? You know, we have a growing number of people working as IPs in those settings, and you know, the CIC might be applicable, the long-term care probably not so much, but curious to hear your guys' thoughts on additional certification options.
Well, I'll begin, and Jessica might want to fill in the blanks, but certainly what we're looking for all the time is how that's where our job practice analysis comes into play. So we look at people in our field and where they're working and what they're covering, what are the areas or the components of their role and responsibilities, to make sure that we incorporate those into our certification exams. And with that, it's whether or not one requires additional exams for that specific areas, or are they reflected quite nicely in the existing CIC? So I think that that's really where we're looking at. I think this is also where APIC has been, and IPAC Canada and other professional associations have also been looking at how they can support the knowledge and the development of knowledge in our field in those particular settings as well. And Jessica, I'll just turn it over to you.
I think that's very well said, Sandra. I think we would have to really demonstrate there's a broad need for developing another examination. So I think long-term care, the survey results show that this was something that we could support. There'd be test takers. So I think we would just have to, survey our certificates, do the practice analysis, and really demonstrate that there's a need to develop a full-blown certification in something like ambulatory care.
All right, great. Thank you both. Another great question. Someone asked that they saw that the scoring of the exam has recently changed. And I know you went through some of the number of questions and how many are test questions and how many are specific to the scoring. This individual is wondering if you can explain, anything additional in the way the exam is currently being scored.
Sure. So kind of a two-part answer with that. Anytime we do a practice analysis, there is potentially a change in the cut score, the pass point of the examination. And that's just, the content areas on the exams change, the percentage of different areas on the content outlines change. I think this question is in regards to the score reports. So our score reports recently changed for the AIPC exam, the LTC exam, and will be changing in January of 2023 for the CIC exam. Please be assured there is no change to the actual pass point. The exam is not easier or harder. We are just changing the way in which we display the score of the examination. We found there was a lot of confusion in terms of what does my score report mean? So for candidates that were unsuccessful, there was some confusion. Oh, did I just miss by one question? Did I miss by two questions? So we've moved to a scaled scoring model. And I can drop in the chat of what that means. So none of the scoring has actually changed in terms of difficulty of the exam. Essentially, you need a score of a 700 to pass the examination. Oops, I'm sorry. And then I will drop in the chat of what those sample score reports look like. But just please be assured that it's only in how we're actually reporting your score, but nothing has actually changed within the scoring. So we want to do our best to really give information that's easier to digest if you don't pass the exam on where you need additional help in certain content areas. So that was our intention in changing the way in which we're reporting the score.
Right, great. That is very helpful information. We do have a couple of similar questions around what it means to be actively engaged in infection prevention for that work-related requirement. There's one question specifically around working with health departments and long-term care facilities and their COVID protocols, vaccination, testing, another one specifically around COVID as well. So I think we're seeing a lot of individuals hired to work within infection prevention and control in the last couple of years, definitely focused on COVID specifically. So does that allow them to be eligible to sit for the certification?
Well, it's Sandra here. I'll begin, and it really depends on how you've been hired. I mean, we have been in a pandemic, so even those who have their certification have been preoccupied with COVID-related approaches and activities and measures putting into place. So, but if that's specifically what you've been hired for, I've had this question before where someone has asked me, they've been hired to work with the screeners, to help train people on donning and doffing protective apparel. Does that make them eligible? And I would say that if this was not their role before and they have actually just been brought in to do this, they might want to consider the AIPC, the associate IPC initially, and so they can just demonstrate that broader foundational knowledge, not just how to don and doff PPE, because some people think that that's all there is. I'm not saying that the person who's asking the question is thinking that, but out in the public, people think they do know infection control only by having learned how to don and doff PPE, or they train others to do this. So if you really want to demonstrate you have a little bit broader knowledge, foundational knowledge, and you would like to get into the field and gain that experience that will make you eligible, the AIPC may fit the bill for that.
I think that is a great recommendation. All right, a few additional questions. There's one individual that wonders about a more comprehensive list of healthcare related degrees in terms of eligibility, and if there is anything available that is out there, maybe those that are not healthcare related. So, does someone have to have a healthcare related bachelor's degree or associate degree to sit for the CIC, or could it be non-healthcare related?
Well, and Jessica and I have had these conversations actually. Sometimes someone comes in with a very unique portfolio with their undergraduate degrees. And so not that we can do it for everyone, but on occasion, one-on-one, we've actually taken a closer look, because there might be someone who does have a non-healthcare related degree, but they actually had a lot of their electives were in the sciences, in microbiology or biology or other things that actually gave them a little bit more foundation, and now they would like to get into the field. So, and again, someone who's sort of in that particular quandary, they might want to consider submitting that particular degree to see if it's eligible. We couldn't list all of them because we're looking at degrees that are actually offered or given around the world. So we don't know every program and every university's offerings. And again, sometimes if someone is demonstrating the knowledge and the skills that are needed, and the employer wants to hire them into this field, again, the AIPC might be that stepping stone for them. But Jessica, I don't want to tax our staff, but we have looked at some cases one-on-one when there have been some unique educational, their foundation is a little different than the typical healthcare related.
I would agree. I think it's impossible for us to give a comprehensive list of everyone. So when in doubt, that's what our team is here for. So you can always email us at info@cbic.org and someone will get back to you. So we do our best to provide a list, but if you're not sure, just send us an email and we can look into it for you.
I just want to add that when I mentioned the AIPC, it is a great stepping stone. It's a great opportunity for those who want to demonstrate their foundational knowledge and gain the experience, but it doesn't automatically make you eligible for CIC. So it's really important to know that it helps you get in the door, but the eligibility for CIC is still what we've written, which is the amount of experience and your role within the field. Remember, CIC is a package. It's your experience, your work that you're doing in the field, and your foundational knowledge.
Those are great points to make. Thank you both. A question around the CV. I think this is a very good question that a lot of people probably wonder about. If there is a certain format that is needed for the resume or the CV when they submit for eligibility.
So not a certain format, but some helpful hints. Putting those in chronological order is always helpful. You know, putting your most recent employment up at the top, that helps staff. Making sure you list your current employer on there. Sometimes we get a little confused if the job description does not match the resume. So using that same job title, the same employer, just so staff can easily make sure that you're actually working in the job that's on your job description. And then that's really, I would say, you know, making sure that you show us that you have a year of full-time experience or 2 years of part-time. So we don't assume anything. So if we can't tell from your resume or if it doesn't match the job description, that's when we come back to you.
All right, great, thank you. Another individual is wondering about the cost of testing, and is it true that the cost of the exam will be increased in 2023?
Yes, and I did drop in the chat the list of our examination fees. So the current fee for the CIC in US dollars is $375. It will go up to $410 on January 9th, 2023. So there will be a slight increase in fees.
All right. And if someone doesn't pass the exam on the first try, how long do you have to take before you can retake the exam? And do you have to resubmit all the materials that you initially submitted to be approved for the second time?
Sure. So you do have to wait 90 days between examination attempts. And I would say if you're submitting your examination application for retaking after that 90 days, then your documents should still be valid. But you know, we can't say whether or not you're going to wait a year between attempts, 2 years between attempts. So make sure everything is at least within the same calendar year. So if you've switched jobs or you're no longer, you know, under the same supervisor, then we're going to want to see updated information. But, you know, after 90 days, it should still be current, but, you know, just keep it within the same calendar year is my recommendation.
Great. And Sandra, I know you've talked a lot about the AIPC, and there are some questions around the differences between the AIPC and the CIC. One does wonder, is it the same exam, just shorter? And I know it's not, but I wonder if you could touch a little bit on the differences between the two.
Yes, thank you. The AIPC, of course, we don't expect a person to have had experience in the field. So the questions on the AIPC exam are really around recall. So it's just understanding terminology and basic foundational understanding of infections, infectious diseases, and infection prevention and control. It's really around recall, whereas in the actual certification exam, the CIC, or in recertification exams, they're more judgment as well. So there's a person has to have that foundational knowledge, but then they have to apply it. And they apply it to different scenarios and situations. So it shows the growth and the maturity of the person who has the CIC. And that's why we ask for experience. It shows that growth and maturity of the person with the CIC, where the AIPC is really more around memory and making sure I understand some very key foundational building blocks for the field. So that's the major difference. And hopefully people recognize that if they were doing both exams.
That's a great explanation. I know a lot of people have wondered that and asked that since the AIPC came out. So thank you for that, Sandra.
And I would also encourage them to take a look at the content outlines as well. So you'll notice there are some differences in between the two content outlines. So that might be a good resource as well.
Another question that's not necessarily related to the exams themselves, but I think it is a good question. Does CIBIC allow and consider international certified IPs to volunteer on the committees and the board?
Yes, absolutely. So every year we do a call out for volunteers for our test committee, and we do have an international test committee that helps write the examination questions, review the questions. So absolutely. And we have internationally certified CICs on the CIBIC board as well.
Great, thank you. And one last question in the Q&A. Is there a limit to how many times an individual can take the test?
There is not. So every 90 days is the maximum or the minimum to wait between exams. And I would say if you're unsuccessful on the exam, you will receive a score report that shows areas that you do need further studying on. So I would use that to guide your studies.
All right, I think we've covered most of the questions in the Q&A. Some of them were bucketed together a little bit, of course. And I think all of them that I've seen in the chat have come across into the Q&A as well. I'll pause for a moment to see if anyone has any additional questions that they want to put into the Q&A section.
I see one in just the webinar chat. Can we do a webinar just on infection prevention units? And I would say the answer to that is yes. So our goal is to do something at the beginning of the calendar year when everyone's kind of getting ready to submit their portfolios, recertify by exam. So I think that's definitely a future webinar, as well as one potentially just on long-term care and one on the AIPC examination. So we will get into a regular cadence with these webinars.
So I think those will be great resources to have in the coming years. All right, well, a special thank you to both of you, Jessica and Sandra, for this information today, and everyone who participated in the program. I'll turn it over to Natasha now to wrap us up.
Thank you so much, Angel. And yes, I just echo everyone's thanks so much for participating today. Lots of great questions, and we're looking forward to future webinars partnering with CIC. As a reminder, the webinar recording will be available within 24 hours, and all registered attendees will receive a notification with a link directly to the recording. If you have any questions, please feel free to email elearning@apic.org. Thank you again, and have a great rest of your day, everyone. This concludes the program today.